I do today? Did I do my homework? I don't know where my keys are. Where am I? Have your kids said that before to you? Have they like forgotten about all the things that they've done? You ask them to do something, they forget to do it when you just told them, but your other kid doesn't act like that. Or maybe you give them money to go to the store and they lose the money. And then they come home and they like, oh, I don't have it. And you're wondering, I just gave you the money. Why is this still happening? And why does this always keep happening to my one child or many childs? If you're a parent that's like that, if you're frustrated, your kid might have an attention caused by various different disorders. And the one disorder I want to focus on today is called attention deficit disorder. So ADHD is classified by the DSM-5 criteria as having inattentiveness or hyperactivity before the age of 12 in two places, school and home setting. So that's the essence of the ADHD diagnosis. And a lot of things can mimic ADHD. So lack of sleep can mimic ADHD, a poor nutrients intake can mimic ADHD, and also post-traumatic stress can mimic ADHD, depression can mimic ADHD, anxiety, conduct disorder. A lot of things can mimic ADHD. It's also a diagnosis of exclusion. So you have to rule out all the other things that I mentioned that could mimic ADHD before you can actually make a diagnosis of ADHD. So let's talk about some of the things that can mimic ADHD. So lack of sleep. Most kids need more sleep all kids need more sleep than adults. So I have a lot of kids who are getting 8 hours of sleep like adults, but I'm like, no, they should get 10 hours of sleep. So the younger you are, the more sleep you need. As you get older, the less sleep you need. So teenagers typically need about, on average, 9 hours of sleep a day. But a lot of teenagers, as you probably know, are not getting 9 hours. So we have to get them in bed on time, and we have to take away the phone, no screen, because it affects your ability to sleep. You have to turn off the lights, and you have to read a book or do something that's not gonna stimulate you as you go to bed. And if that doesn't work, we have to figure out why. And that's where you talk to your pediatrician. And then the pediatrician will probably ask the kid a lot of questions like, do you have anxiety, or you're worrying about something? That could also affect your sleep, and that could also mimic ADHD. So that's sleep and anxiety. Other things that can mimic it is depression. That's a big one. People who are depressed can have a lack in concentration, and when they go to school, they might not be able to focus on what the teacher is saying or focus on doing their homework at night. So that's something you want your pediatrician to assess to make sure that it's not that. And then there's other things like if the patient or kid's parents are going through a divorce, that can be really traumatic, and that in itself can cause the kid to not be able to focus. And at that point, you might have to seek the counseling of a therapist for the child. But once you rule out all these things, then what I usually do in my practice is I give the parent 2 forms. Both of the forms are under the umbrella of the Vanderbilt assessment for ADHD. It's a standardized scoring questionnaire. It's not diagnostic, so keep that in mind. But I like to give this paper because I like to be objective. It stimulates the parent's thought process, and it helps them think through the past and see, did my child do that? Is that a problem? Asking them the question itself helps them pay attention to what might be going on with the child. And that alone is worth it, right? You have to give the parent one because that's one setting, and then you have to give the school one because that's another setting. And I usually tell them to bring it to the psychiatrist or the mental health provider, the specialist, so that they can score it themselves. And once they score it, then they get a better idea of what it could be. Is it really ADHD? And it also tells you if it could be conduct disorder, if it could be anxiety and other things, because sometimes those things come with ADHD, including depression. Sometimes kids who have ADHD feel misunderstood. You have to remember, when a child is hyperactive, they are not doing it on purpose. They're not doing it on purpose. They can't control it, essentially. They have a million thoughts going on in their head. And you might say something to them and they want to do what you said, but they just have these thoughts coming in and they get distracted easily. So you have to approach it with a little compassion. That's how I approach it with kids, because they're just learning, you know? And what I'm trying to say is that when they have the ADHD, sometimes they get yelled at, or people treat them like they're doing it on purpose, or treat them like they're a bad kid. And then that causes depression or emotional dysregulation, mood swings. And you'll find that kids with ADHD usually have these outbursts because they don't know how to say how they feel, because it's so much, it's so overwhelming. They get overwhelmed with life, everything, school, friends, home. So what they need is structure. They need structure, right? Physical structure and also like emotional structure. What that means is they need a folder for every class. Everything needs to be color-coded. Everything needs to be labeled. It's kind of like that Marie Kondo method. Everything has to have a home. Your keys has a home. It has to be labeled keys. This is where you put your keys when you come home. Your clothes have to have a home. Your books have to have a home. Everything. Once you get that done, they also need coping mechanisms. How do they cope with their emotions? How do they communicate? Because a lot of them have struggles being in crowds and having friends because they're different. They're not stupid. They're brilliant. They're brilliant. ADHD people are brilliant. They're very artistic. They can think outside the box. They're usually the ones who end up disrupting whole industries and business. You just will never know it because they're under medication. You will never know it. So it's very important to give them that structure so they can adjust to the world, right? We all have to adjust a little bit. You have to cope so you can adjust. So give them structure, help them regulate their emotions, help them find the words to say how they feel. If they feel like people don't understand them, help them learn how to explain themselves to people so they can get what they need, right? A lot of kids fall through the cracks because they don't communicate with their teachers what the issue is, and the teachers don't have no idea because the teachers is not in their head. What makes this a little bit more complicated is young girls are more likely to have attention deficit disorder without the hyperactivity, and that could be very hard to deal with because it's hard to find. When you're not hyperactive and you're sitting still and you're looking someone dead in the eye, but you're not paying attention because your mind is thinking about cookies or going out with your friends, and you have a million thoughts. To an outsider, you look completely like focused, but you're not. So a lot of young girls end up missed. So keep that in mind. Stay alert, and ultimately you have to go to your pediatrician. And if you don't feel comfortable with your pediatrician, if they're brushing it off, but you feel like something's wrong, you just don't know what, or you don't know how to explain it, I hope this video helped. 1, 2, you might have to change the pediatrician, and that's okay, right? And also getting a diagnosis is your first priority. What you do after that, we could talk about that, but you have to get a diagnosis, because if you don't know your kid or your kid doesn't know themselves, that's the worst situation you would ever want. Because when people don't know who they are, they can get taken advantage of. And I don't want kids to get taken advantage of or bullied or mistreated. I want kids to feel empowered. But knowledge is power, so you have to get the diagnosis. If you're scared of medication, you can say no, but at least get the diagnosis or get an assessment. So this is Dr. 𝐀𝐃𝐃. I just wanted to say this because I feel like this is one of the gaps that I see a lot in clinical practice. Thank you so much. Stay tuned, subscribe. Bye.